Hi, my name is Jason Bunn-Parsons. I'm once again here with my mentor, Sue Golubock, to finish off the series Core Concepts for Understanding Autism. Part 3 will be dealing with points 4 through 9. Um, and so we will be doing a fourth video in this series, that's on a separate topic. But anyway, so without further ado, let me go ahead and pull up the document that we've been working on. Okay, is core concepts for understanding autism and how to improve the quality of life of all autistic aspies. Okay, and so we've already done the first 3 points. The first point was done during our introduction. Points 2 and 3 was done in the second video, and so this time we're starting up with point 4, which many autistic aspies prefer pets over human beings because they feel emotionally safer because they don't judge or hurt us. And that is literally an exact quote of what I hear so many autistics say when they're asking, well, why do you like pets so much? And this is the overriding answer, and it has to do with how we're treated by a lot of human beings. And so, Sue, if you'd like to go ahead and tag in on that yourself.
I totally agree. In that they don't judge us. They they accept us unconditionally
Mm-hmm.
for who we are, the way we are. And that's not always true because we are so misunderstood.
Mm-hmm.
Um, when they first started working with autistics, they called our brains the little black box because they couldn't figure it out. Um, and I think it's only by understanding, and this has been my passion, is to try to explain the way the autistic brain actually works based on decades of research on how our brains work differently. The
Mm-hmm.
more you understand us, the easier it's going to be, and hopefully it'll be less judgmental.
Yes, and so as far as yeah, the autism meetings are the biggest gathering of animal lovers outside of animal rights advocates. Literally, yeah, you won't find, yeah, you'll be hard pressed to find anybody at our meeting that doesn't have some sympathy towards animals and we might also add other vulnerable citizens. And so because we identify so much with them, and as far as a particular pet, one particular pet, I hear a lot about cats. How a lot of autistics identify with cats more than anything because they don't come when you summon them. Okay, and yeah, just the overall personality of cats is something that I've heard so many autistics identify with. And yeah, it's yeah. So you've heard our members describe this as well. You have anything you want to add on to this particular aspect as far as why autistics
No,
live
I
by
think you
cats?
identify because cats are singularly independent.
Mm-hmm.
You can get some cats that are warm and loving and act more like dogs than cats, but cats have learned to survive on their own, much more so. And they can be very, very independent. And that's the unfortunate part because with autism, we don't always develop that social connectedness with other people. And so it appears as if we are content to be in our own world and be isolated. But that is so unlike the truth.
Mm-hmm.
We would love to be more socially connected.
Mm-hmm. Yeah. That's one of the things that I noticed in my own life as I would go through these cycles in which I would reach out, get burned, go back into my shell, get lonely and miserable, reach out, get burned, go back in my shell. And so I just had this repetitive cycle going throughout my schooling years of being lonely, reaching out, getting burned, and going back in my shell. And so yeah, that was definitely a cycle that I went through repeatedly. You know, I was, I was both parts of the cycle every single year. You know, you know, it, so anyways, um, all right, so let's go on to number 5. The struggles that autistics face don't require a master's degree to, or wait a minute. Okay, not every struggle. Okay, I think there's a typo in here. Okay, we'll have to fix that on final. But not every struggle requires a master's degree to solve. There are actually common sense strategies such as stress management, emotional regulation, that that are suggested to all human beings. The difference is, you know, a lot of human beings choose not to follow, that these advice, breathing in through your nose, out through your mouth, that this is a common relaxation technique, that is common knowledge amongst humans. But the thing is, most people I observe do not actually practice that when they start getting stressed, and all these stress management techniques. My personal observations is that most human, otherwise they wouldn't need to keep writing books about them. That's the reason why so many books are written about it, because human beings don't do this. Okay, autistics, we have to learn these. If we don't learn these, we will unravel. Okay, and I actually learned these through through going through a general purpose 12-step program, which I went for codependency. But this was part of any kind of a self-improvement recovery program, is learning how to manage stress, because when you're stressed, you're going to relapse into whatever your dysfunctional behavior is, whether in my case codependent behavior, in the case of addicts, whatever substances they abuse. Stress is the trigger for this dysfunctional behavior. And yeah, I didn't have to pay a cent, because the 12-step programs are self-supporting. You can contribute if you want, but you don't have to. And yes, I know that there are other issues that definitely require somebody with the brilliance of Sue. I do consult with her, with some of these students with extreme struggles that's that even I can't figure out. But for the most part, a lot of these struggles just require common sense solutions that anybody can, that everybody's supposed to do, but most people don't. So Sue, you want to comment?
I think the reason a lot of people don't is because their brains work so easily and automatically to do the
Yeah.
things they never have to really even think about it. Life is so much easier for them, whereas autistics tend to have to do a lot of things on a thinking level that other people do on an easy automatic level. So we're expending a lot of energy, and then you add to it that people, the expectation is that we should strive to be like everyone else, which puts pressure on us to try to mask who we are and pretend to be who we are not, which again adds stress. So, the stresses that we're feeling, we need stress
Yeah.
management strategies to be able to deal with a world that doesn't understand
Yeah.
us and therefore doesn't really understand how to best support us.
Yeah. Well, I have a bit of a different take. I think that non-autistics do a better job of putting up facades of pretending like they don't need to take that minute to take that deep breath and everything. But when you but but I've known a lot of these people, and they are stressed, they are aggravated, that they get upset, so obviously it's impairing their quality of life. But the thing is, this kind of stuff takes this is a type of discipline, internal discipline, where you stop yourself instead of just being dragged along by the circumstance, and this idea that you have to stop the circumstance right now. You need to stop yourself, get control of yourself, so you can then get control of the circumstance, and so yeah, so my observation is a lot of neurotypicals can get away with not doing that and still managing to persevere. They're stressed, they're angry, they're all this other stuff. They can still persevere, but an autistic can't. Okay, we cannot persevere unless we do the things that every human being needs to do during these times of stress. So, would you like to?
And I agree.
Yeah.
Actually, I think we are on the same wavelength, in that neurotypical people don't feel the need like we do
Yeah.
for stress management strategies. They somehow get away with
Yeah.
some of the ways in which they deal with stress
Yeah.
that are not always the best ways to deal with it.
Well, and I think also a lot of it is that our baseline stress level, because, okay, we have sensory processing, we have executive functioning difficulties. So if we're to put it on a scale of 1 to 10, okay, our idle stress level, that their idle stress level might be 2 or 3, ours might be 5 or 6. Okay, and a situation that bumps us up to 2 spots, that puts us a lot closer to 10 than it puts them. So I think that's also an aspect as well, is that we have these underlying issues that keeps our baseline stress level elevated. And so these preemptive stress management, such as a lot of people start off the day doing meditation, breathing exercises. There's a whole variety of different things that people do to bring down their baseline stress level, to start the day off. And um and 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 yeah, autistics definitely need to do that. Find something that works for them, because what works for one doesn't work for all. Yeah. So, anyways,
I like your analogy.
yeah.
Our
So,
stress levels are starting at a much higher level than
yeah.
others.
So, okay. Um, okay. Many autistic Aspies have developed techniques that help them overcome their struggles. How often they're often discouraged instead of encouraged, stemming in alternatives to forcing oneself to maintain eye contact. Uh, are 2 leading examples, and I'm going to let you go ahead and kick off on that right now, because I know these are major issues that you discuss on a regular basis. So go ahead and just address that right now.
And what I want to say is, yes, I know it frustrates people and that's a classic example of autism, is the repetitive movements that we do. But as an occupational therapist specializing in sensory processing, I know that repetitive movement, any movement of the muscles and joints, has a calming influence on the nervous system.
Mhm.
And stimming is just that. It's an easy to do way of self-regulating. And so typical people also stim. They just don't call it that. They call them nervous habits. When they twirl their hair and they bite on their fingernails and they tap their foot, those are all non-purposeful repetitive movements. And they serve the same purpose of calming them down. So I actually did a comparison using Wikipedia, on meditation and stimming. They have basically the same purpose, which is to calm you down, to focus on something that is repetitive, like a mantra, um, that keeps you focused in the moment. Um, and they involve some kind of repetitive action, whether it's slow breathing in, breathing out, but it's a repetitive action. The two match. And I think this is the autistic's way of self inventing a form of meditation, of self calming. If people would only realize that's what we're doing, but instead they discourage it because, oh, that's distracting to the other students, or that's not typical. That's not the way, people don't do that. So it's embarrassing. They discourage it without instead recognizing You are stressed. You're doing something that tells me you're stressed and trying to calm down, which is great. Let's look at a way that might better fit the situation, or let's find a way that works for both of us, that makes us both comfortable doing it. Um, but work with the individual if you recognize that this is what's the same thing with giving eye contact. I found that if I try to watch someone's eyes, number one, I see the movements. I can't interpret what they mean. But as soon as I was focusing on their eyes, my ability to hear what they were saying and process what they were saying dropped by 50%. I cannot be in the visual area of my brain and the auditory area of my brain at the same time without one being compromised. So, those two examples are saying if you understand how the autistic brain works, you're going to be more empathetic and be able to help them and support them rather than take away their coping strategies.
The only thing that I'll add to what you said is as far as when I make eye contact, okay, it interferes with my ability to organize my thoughts, okay, to focus on what I want to say, and so, as a public speaker, yes, you do want to be, observing your audience to see how they're responding to what you're saying. Are they confused? Are they angry? Are they getting it and all this other stuff? And so yeah, so I've trained myself to do check-ins where I just briefly go at and I make that brief eye contact in order to get that information. But then once I start focus on, okay, now what am I going to say next? My eyes will just simply drift off of them. I don't choose to break eye contact. Okay, that they just disengage on their own, and I will also add another thing, as far as a middle-aged male, okay, trying to make myself make eye contact with young ladies, okay, it is extremely unnatural, and these young ladies wind up feeling extremely uncomfortable with me because I'm trying to be something that I'm not, okay, and the way that I look when I'm trying to force eye contact literally creeps them out, okay, and so yes, I do avoid eye contact in those situations for the comfort of the person that I'm actually trying to speak to, so that way, especially these young ladies, I don't want them to think I'm some dirty old man that's got these ridiculous ideas that are never going to happen, but that's what happens when I force myself to make eye contact, and so it just completely backfires on me. So you want to add anything to that, Sue, or
No. And
no?
again, you're just emphasizing we are both individuals. We both
Yeah,
have similar difficulties being in the two parts of the brain at the same time, but we express it in different ways. And people have to recognize that.
yeah. Okay, so number 7. Oh, wait a minute, I forgot B. Autistic mentors can teach non-autistic loved ones and professionals by example how to work better with autistics by observing how they support their fellow autistics. And I have this specific student in mind. Okay, she was at the time a first grader, okay, and I identified with her more than anybody else in the class because she had an extreme aversion to chaos, okay, and and so one of the things that I would try to do is mimic my emotional regulation strategy by just going to by just getting next to her and just in a slow, calm voice saying it's the situation, like what one of her classmates is having a temper tantrum because he's not getting his way. It's being taken care of. Just just give us a chance to take care of it, and just basically helping her focus on the fact that a solution is being implemented. Just need to hang in there, and and this is something that so many of my coworkers just did not grasp the significance of what I was doing. That's and the thing is, yeah, yeah, if they would, uh, emulate what I was doing, they could actually do it more effective because, like I said, I'm also, have an aversion to chaos, and so, well, so when the room was so chaotic that it was bringing her to the point of a meltdown, okay, it was also taxing my abilities, not to the point where I was on the brink, but impairing my ability to actually, to actually teach, actually explain the technique, do the breathe in through your nose, breathe out through your mouth, these very simple stress management techniques, and so, so that's one of the things that I've explained to my coworkers. If they understood how important that this is, that they could actually be more effective, in many of these cases, if they can actually coach the student through the breathe in through your nose and out through the mouth, and these other things. So, Sue, would you like to comment on that?
Yeah, I think it's just really, really hard for non-autistics to understand what they've never experienced. And if they have never experienced what we feel when there's chaos around us, in terms of being overwhelmed, overloaded, and on the brink of, I can't handle it anymore. If they've never experienced, it's very hard for them to get what it is you're trying
Mhm.
to show them. Um, and this is where it may take later an opportunity to sit down and re talk about the experience. And it's unfortunate that you often don't get that opportunity within a
Yeah,
school setting to sit back and reflect on what happened so that you can have the words then,
right.
later, that
Yeah.
you couldn't at that time,
Hmm.
to explain to them why you did what you
Yeah.
did and how it felt to you.
Yeah. Well, and it's not so much that they don't know what it feels like. It's that they're not brought to the brink as easily as we are. Okay. That much smaller things can bring us to the brink, because yeah, that they get brought to the brink, and that they go over the cliff, from time to time. But the thing is, much smaller things, because like we said earlier, okay, let's say, on a scale of 1 to 10, their baseline stress level is a 3, ours is a 5 or a 6, and that's the whole thing, is that we don't have as far to go to the brink as they do. And so yeah, so anyways, um all right, so going on to number 7 here, go and scroll this up. Okay, and okay, so understanding human beings that lack an effective means of self-expression can be can be challenging, like playing Battleship. Okay, lots of misses before you finally score a hit, but it's important to keep exploring the possibilities until the breakthrough occurs. And this is another thing that a lot of my coworkers think, oh, I'm just making stuff up, I'm just throwing things out. Well, kind of, sort of, yes, yeah, I'm going through, basically a mental list of everything that's you've taught me, as far as, what could be triggers, like, okay, is this present environment, is this present environment, is this present environment. And so basically, so yeah, to somebody who doesn't understand that I've actually been trained to actually look for all these issues, it might look to them like I'm just making stuff up. But the thing is, I'm not making it up. I'm going through the checklist one at a time. A1 miss, B2 miss, C3 miss, hit. Oh, finally got a hit. Okay, when you're dealing with individuals who don't have effective means of self-expression, when their only communication is behaviors, they literally have no other way to communicate. That's basically what you need to be doing. You need to be playing Battleship. You need to keep calling these shots. You need to, and I don't know if it would be feasible to come up with an entire checklist, a written checklist of every possible trigger. It'd be extremely lengthy. But wouldn't hurt to, to work on a checklist like that. But yeah, it's so. Anyway, Sue, you want to chime in on that?
Sure. I totally agree. What Jason is talking about is trial and error. It's one of the most effective ways of actually learning and growing is through trial and error. You try it. If it doesn't work, you go back to the drawing board and you do again. Eventually, you will learn. But unfortunately, sometimes um, programs dictate this is what you should do in this situation, and if it doesn't work, they just abandon. They're not going back and using this trial and error approach.
So, okay. So, triggers can often be cumulative. So, the one that might be the last straw may not even be the biggest stressor leading up to the adverse reaction. And one of the best examples that I like to use is okay, so that sometimes the light rail can be a bit chaotic, but that's okay. I can usually manage unless my brain is working, is trying to figure something out. Like I'm going, before I got a car, I would use the light rail to go to the Saturday meetings, and there was several times that I presented, and so here my brain is wanting to just visualize what I'm wanting to say, and basically scripting, like you mentioned in the last video. That's basically what I'm doing, is I'm trying to script, and it's so, oh well, today that there's an ASU game going on, so the light rail is packed, and or there's something major going on at Tempe Town Lake. There's just so many reasons why that light rail could all of a sudden be twice what the capacity, or twice as many people as normal. And when that happens, yes, I can literally get headaches. I can handle all that extra chaos if my brain is just completely idle. It's not preparing itself to do a presentation. Yeah, I can go ahead and manage. But if I'm trying to do a presentation during the chaos, I show up. My brain is absolutely putty. And there's a couple of times where well, at least one time where I present, I told Sue straight up, yeah, you're going to need to let me, no distress here, because my brain is just completely, hyper stimulated from the right. So, so yeah, that's what a major example from my own personal life. Sue, would you like to go ahead and comment on this?
Yeah, I think most people understand the stress that comes with multitasking. Multitasking doesn't necessarily result in you being more efficient or effective.
Mm-hmm.
You just may think you are, but research suggests that it's not the best way to do it. So you kind of know what it feels like when you're trying to multitask. And this is what Jason is talking about, is that his brain is already working. And as he pointed out with his analogy of, we already start off at a much higher stress level than typical people. So we're going to reach that, the final straw that breaks the camel's back, um, much more easily. I found by the end of the day of working an 8 hour day in a school setting, on the way home, most nights I would be screaming just to release some of the tension from trying to hold it all together um, during that day. I finally worked out with my husband. He would ask if I would call him before I head for home to let him know if I need downtime when I would get home, so that he would allow me at least 20 minutes before we would sit down to dinner, so that I could do the sensory things that I needed to calm my nervous system back down again. Because otherwise, he said, you're here, but you're not here.
Mm-hmm.
I.e., he could see my brain just wasn't able to connect and able to carry on a conversation that made any sense to him. Um, that's what I had to do every day in order to be able to work.
Mm-hmm. And so an example at school. Okay, so basically, the kids start off at home, and how they do at home will impact, their bus ride. Okay, how things are on the bus is going to impact how things are on how they do in class, how they start the school day off, how they end the school day off is going to impact how they are on the bus when we send them back home, and how they are, on, it's so, well, one of the things I'm trying to get my fellow coworkers to understand is that we're an interdependent cycle, okay? And that's, and one of the things that I always do is you know, um, yeah, if I have a student that's particularly stressed out, I stay on the bus with them to help, get them calmed down. Where most of my fellow IAs, they just throw them on the bus and it's like, okay, we're all done with that. I did my part. Now, these bus drivers, yeah, in the bus aid, yep, they've got to, take it from there. And it's like, no, that's not fair to them because of a lot of reasons, And so that's one of the things that, to recognize that, that's, and well, we could do an hour-long presentation on this subject alone, of how these different triggers accumulate. But if we're going to talk about, specifically, a problem that I see at the schools is the fact that we're not, that we don't recognize that all three, the home, the bus, and the classroom are all interdependent on each other. That we really need the other to, to send the, to transition the child in the best, situation, possible. And I fully understand parents are under a lot of stress and so I'm not faulting them. you know, uh, you know, if, basically, I'm more looking at it, as far as, I believe that us IEs could be doing more in the afternoons is what I really think, because again, the parents and the bus drivers really have their hands tied behind their backs, early in the morning, and then later in the afternoon, for various reasons. Us IAs, we have the ability, instead of, just throw them up on the bus and then, chit chatting with each other, afterwards, that, if we have a child that's particularly distressed, we need to stay on that bus with them, and we need to get them, do our best to get them calmed down in order to make it easier on the bus driver. That's something that's, that I've definitely disagreed with many of my fellow IAs about, as far as, in the afternoon, sending them home. So, Sue, you want to comment on any of that?
No, I agree, and I've heard the same thing from parents. Um,
Mm-hmm.
my child, the teacher says they're ideal during the school day. They're
Mm-hmm.
cooperative. They come home and they're holy terror,
Mm-hmm.
and it's because all that built up stress.
Mm-hmm. And so anyways, okay, so finally, just because some autistic Aspies have have aversions to certain things, that doesn't mean that they all have these aversions. Therefore, those who do not have them should not be denied what they want because of those who actually do have these aversions. So yeah, blah blah blah. So bottom line, I'm thinking specifically about okay, yes, a lot of autistics have tactile sensitivity. They don't like to be touched. Okay, I understand that. However, there are a lot of other autistics, that most of the autistic students I worked with are very affectionate. They want to hug, and to be hugged. Okay, and and then there's this one particular um, first grader I worked with last year. Okay, she had no problem with affection, just not right here in the back of her head. This was her one sensitive spot. Okay, and so I would be quick to coach anybody that was new. Okay, yeah, you can show her affection, just not here. That's the one place she doesn't like to be touched. And so it's so yeah, I've seen so many people, particularly when an autistic is having a meltdown, they're like scared to get anywhere near them. Okay, there's this other boy, I believe he was in third grade. He wasn't actually assigned to my class, but in the neighboring class, a couple of times I was asked to come and assist when he was having a meltdown, all I did is I would just go and pull up a chair about maybe 5 feet from him, just sit down, and I made sure that there was another place right next to me that he could also sit down. And in both of those occasions, he just immediately randomly threw his arms around my neck. Okay. And so this idea that, this autistic's having a meltdown, everybody get away, get away. Well, for some, maybe. For others, no. It definitely, responding, a lot like the child is radioactive. Okay, that in and of itself, I don't care what child you're talking about, responding to a child like they're radioactive, which is what I've seen a lot of people do with autistics, that they're having a meltdown. It's so counterproductive. Sue, would you like to chime in on some of this?
Jason, you make such a valid point, because what Jason did, yeah, you don't want to assume they want contact or assume they do not want contact. Jason sat down and invited them, gave them the opportunity to choose if what they needed or wanted from someone. And that is the important thing, because I know schools have a regulation about inappropriate touch and giving affection. And so the point that he makes is that he's allowing them to choose, and then allowing them to receive what it is they say they need and want at that time. And that's an important distinction.
So anyways, and we could probably go much greater length on this as well. But anyway, so we are past the 30-minute mark, but I think we've given a fairly well-rounded, explanations to these. Definitely enough foundation to lead to further dialogue with those who are interested in talking about them. So, Sue, is there anything you would like to finish, in terms of what we discussed?
Other than to invite, as you just did, to dialogue, so that people have a better understanding and appreciation for how the autistic brain perceives things and therefore responds to the world around them. And that is going to help, your understanding is going to help you to help us and support us in ways that we really need.
Okay. And so with that, we're finishing off this particular document. And so the fourth part of this series is actually going to be a separate document. In point one, we were talking about respecting, the human rights that autistics have. And so we're going to be going into the ones that I've observed aren't being respected. In my opinion. So everybody's going to agree that, oh yes, all human beings have these rights, but are you actually respecting these rights? And not just with autistics. Quite frankly, human beings don't do that great of a job of respecting the rights of other human beings, in general. And so, but these are going to be, ones that I've observed that, that are very important to the autistic community and are not being respected by a lot of people. So last word, Sue?
Okay. No.
Okay. Nope.
Sounds
Okay.
good.
So then you and I will get together tomorrow to do that recording. So until then, bid you all farewell.